Magnetic resonance angiography is a medical imaging technique that builds on the principles of magnetic resonance imaging. While MRI is widely used for general imaging of organs, tissues, and structures, providing excellent soft tissue contrast for the brain, spine, joints, and tumors, its focus is not primarily on blood vessels. MRA, on the other hand, is specialized for vascular imaging. It allows visualization of blood vessels and blood flow, helping to detect aneurysms, stenosis, and vascular malformations. By using flow-sensitive sequences and sometimes contrast agents, it provides a non-invasive alternative to catheter angiography. Safety is an essential part of this process. Specific absorption rate, or SAR, measures how much radiofrequency energy is absorbed by the body during scanning. International standards limit whole body exposure to 2 watts per kilogram over 6 minutes, and head exposure to 3.2 watts per kilogram. The 0.5 millitesla, or 5 Gauss line, marks the safety boundary for public access. To reduce SAR, adjustments can be made such as lowering the flip angle, increasing repetition time, optimizing coil placement, or using active cooling. MRA systems operate in normal mode within these limits, or in first-level controlled mode with closer monitoring. The workflow of MRA follows a clear sequence. The patient enters the scanner and aligns with the main magnetic field known as B0. Radiofrequency pulses at the Larmor frequency excite protons in the blood. As these protons relax, they emit signals that are localized in 3 dimensions by gradient encoding. The computer then reconstructs these signals into an angiogram image, producing a detailed view of the blood vessels. The physics behind this process begins with the superconducting coil. The magnetic field inside a long solenoid is nearly uniform and is described by the equation B equals M0Ni. Protons in blood align with this field, and when excited by radiofrequency pulses at the resonance frequency, they produce signals that reveal vascular structures. Contrast agents such as gadolinium can further enhance these images. Without contrast, vessel-to-tissue distinction is limited. With contrast, T1 relaxation is shortened, vessel brightness increases, and the detection of stenosis, aneurysms, and collateral flow is improved. Signal detection depends on the radiofrequency coils. Repetition time and echo time control image contrast. T1 relaxation describes the recovery of longitudinal magnetization, while T2 relaxation describes the decay of transverse magnetization. These relaxation signals are converted into measurable data, forming the basis of the image. To achieve high-quality images, the magnetic field must be uniform. Shim coils are used to correct inhomogeneities in B0. Active shimming uses small electromagnets, while passive shimming uses ferromagnetic plates. The goal is to achieve a uniformity of less than or equal to 1 part per million, which improves resolution and accuracy. Magnetic field mapping shows how the field extends beyond the scanner bore. The 5 Gauss line is critical, as exposure beyond this level poses risks for individuals with pacemakers or implants. Shielding ensures that the clinical environment remains safe. The main magnetic field typically ranges from 1.5 to 7 Tesla. At 3 Tesla, there is a balance between resolution and signal-to-noise ratio, making it common in cardiology. The Larmor frequency, defined as gamma times B0, sets the resonance condition and is directly proportional to field strength. Inside the MRI system, several components work together. The main coils generate the constant B0 field. Gradient coils provide spatial encoding in the X, Y, and Z directions. Radiofrequency coils transmit excitation pulses and receive relaxation signals. Radiation and cold shields maintain superconductivity. Engineering analysis ensures the system operates safely and effectively. Magnetic field uniformity is simulated to maintain precision. Gradient coil stress is analyzed to prevent vibration and fatigue. RF heating is modeled with thermal simulations to keep SAR within safe limits. Tools such as ANSYS, COMSOL, and SolidWorks are used for these simulations. Hybrid imaging systems extend the capabilities of MRI. A SPECT insert module can be integrated, positioned at the end of the patient bed. This module includes detection units, a collimator, RF coils, and optical fibers. It detects photon emissions, converts them into signals, and reconstructs them into images. By combining MRI with nuclear imaging, both anatomical and functional data can be obtained. The spatial configuration of such systems is carefully designed. For example, a SPECT insert may have a field of view of 20 centimeters, an RF coil diameter of 33 centimeters, and fit within an MRI bore of 59 centimeters. These dimensions ensure compatibility and effective hybrid imaging. Finally, the patient experience ties all of this technology together. The individual lies on the sample table, which positions them within the bore of the scanner. The magnet generates the strong B0 field, gradient coils provide spatial encoding, and RF coils handle excitation and detection. The result is a non-invasive, highly detailed angiographic image that supports accurate diagnosis and treatment planning.